Welcome back, everyone, to Crazy Enough. I think this is 215 of the Profluence podcast, and we finally switch it up with a different type of guest today. We got Jim here. So, Jim, appreciate you hopping on and super excited to do this one.
Hey, thanks for having me. Great to be here.
Now, give us a little background, right? We didn't put doctor in front of your name, but that is something. You do a ton of cool work with the Big Ten, and that filters into some other stuff. But I'll let you tell the story. So give us a quick, minute, 2 minute babackground, and then we'll run into it.
Yeah, no, come from an athletics background, played football in Ohio State back in the dark ages in the late 80s and early 90s. And I know that not everybody's excited about that, but they had a nice year this year. And then, went to medical school, have a master's in public health. And for the last 20 years or so, have been actually back at Ohio State on faculty in the College of Medicine, head team physician, a lot of roles there. And then in 2021, had a chance to become the first chief medical officer of the Big Ten Conference. And that's been great, working in the Big Ten with all those institutions. But also in 2017, founded a company, the U.S. Council for Athletes' Health, which has a simple mission to partner with organizations, institutions, associations to prioritize athlete health, safety, and well-being, and do that really helping with strategic vision, planning, really helping people to think about what that means from an organizational standpoint, not the in the weeds healthcare of like, how do I take care of this injury, but how should institutions, organizations really think about athletic healthcare, which is a more complex area than it's ever been, especially in collegiate sports. And so got a few hats I wear, and it keeps me busy.
Yeah, it seems like you sort of got the public side, the private side, and then meshing it all together in the business world, which is cool. Quick, do you know gentleman John Peterson? Did you play with him? Was he ever coaching it?
Yeah, I know John. I played with John. I was a freshman when John was a senior.
Super cool.
And then John obviously coached in the Jim Tressel years at Ohio State when I was team physician there. So I know Pete real well.
Cool.
Great person.
Super cool. So his son Cole, me and him are best friends. Cole actually just got hired for the Eagles, which is awesome. And actually, Coach Pete's down in Florida next week. So anyway, I'll send him this, and then we'll meet up, and I guess we'll have a drink or something.
Awesome.
But so as we get into it, I guess let's start on the Big Ten side, and even as a physician side. What have you seen? What were you doing in that space? How has that evolved? Give us the rundown of what that even looks like from a high level. As I think most of our audience, including myself, doesn't have much context or even know what goes into it.
Yeah, I think the biggest thing is, Andrew, to go back to COVID. Obviously that kind of set the sports world, upside down, and I think there was a significant recognition that hey, athletic healthcare is about more than just taking care of the sprained ankle or the knee injury or the shoulder injury. There's really a complex, organizational structure to that. And in pro sports, we've seen that, in the NBA, the NFL, other places. But I think coming out of that in college sports and other areas of sport, it was a recognition of, this is an area of risk. It's an area of liability. It's an area where consistency and alignment is super important. It's also an area where you've got to integrate it with everything else that's going on in sports. So whether that's making money, that's paying players, whether that's competitions, and what goes into that. So I think it is just an evolving area where from youth sports all the way to, like I mentioned, professional sports, people are thinking about it.
Yeah. And I don't know, I guess you can't really use the acronym here of like CMO of Chief Medical Officer. It might confuse with the CMO of the Big Ten. But does the SEC have that? Do most of the conferences that look like across the board?
No, I was the first chief medical officer of any, A4 conference. The SEC has a physician, Katie O'Neill, who's their medical advisor. And again, I don't know exactly how that role, interplays with the SEC, but in a very similar fashion, I think. Other conferences have looked at, different ways of kind of doing that by committee. But the reality is I think having an individual in that seat that is kind of day-to-day thinking about those issues and helping work with in the conference or even larger groups is really important. Obviously, the NCAA's had a chief medical officer since about 2012. And so the NFL, the NBA, other folks, it's part of sport, part of the thought process of sport.
Yeah, super interesting. Now, what's the org structure of that look like? Do all the schools, like their head physicians, sit under you? Do you set the standard? What does the layout of that look like?
Yeah, really, the role in the conference is to try to help set some consistent standards. Now we have standards for our sports in the Big Ten from a medical athletic healthcare standpoint. We do have an athletic medicine cabinet, which is very unique. It's the athletic healthcare administrator from each institution that sits on that cabinet. So it's part of the governance structure of the Big Ten. And so we get a touch point with every institution through that cabinet. And we're involved, obviously through all the championships and everything that happens on campus throughout our seasons. And really, are integrated now into what happens in that medical space. It's obviously up to each institution to take care of the athletes and the people there. They're the experts there. We try to provide that umbrella over the top to make certain that they have the resources they need and that we're contributing in that space.
Yeah, and something we see a lot, or I get a lot of questions from, Jim, is companies more on the private side trying to come in and sell or partner their product or their service or their tool. Like, do you guys sit over that and manage that? Who gets in these contracts? What does that look like? And if that is the true, what's the best way for people like to stand out or have a chance, whether they're going right to the university or going to your side? Because obviously it's a huge space that you deal in.
Yeah, the universities really handle their own, their own contracting, who they work with, what that looks like, the personnel there. We try at the conference level to make certain, again, that when it comes to championships, when it comes to those sorts of events, that we're providing all the resources that are needed there. So we'll coordinate that from the conference level, conference office. But the institutions handle what they do with the athletes. So really getting involved at that level, you want to get involved with the institutions, and be coordinated there.
Makes a ton of sense. Now going over to USCAH, which you've done a bunch with, and now that crosses across universities, conferences, into high schools. Give us the, I'm just reading the mission statement, but it's like ensure athlete health and safety is a priority. Standard broad mission statement. Go give us a little more depth into that, and even the reason for building it, that and the opportunity you saw.
Yeah, I think that the biggest thing is that organizations, institutions, they need a partner, just like in any space. An external partner to really help them think through this. You see it in the legal world, marketing, ticketing. You can go on and on. The NIL space has exploded in college, but that's where our niche is. We've got, expertise with collectively over 300 years of experience in this space. We've written over 250 training modules and customized training and education for institutions. Last year we had it in the NCAA alone, over 280 institutional partners, over 20 conference partners, and had over 10,000, trainings completed just on NCAA health and safety issues. So it's really, how do you not recreate the wheel all the time? How do you have a third party? How do you work with somebody in that space? And it really came out of the idea back in 2017 of there was a void in that space, and people reaching out, institutions looking to that. It's an area where I think there's going to continue to be huge growth. The standards are out there, and you think about college sports, high school sports, U.S. Olympic sports, Paralympic sports, national governing bodies. There's a real need for a standard and for consistency and alignment, and for for a partner in that space.
Super cool. And across the health and safety, I'm sure you have concussions as a big thing. Is it then like standard medicine, or what are the different components of that falls under the branches of all that?
Yeah, you've got the healthcare issues like you mentioned. Concussion is obviously stands out. Things like sudden cardiac death, making certain you're prepared for emergency action plans and things like that, exertional heat illness. These are the types of topics that need to be educated on. But there's also a lot that has to do around the actual institutional response to healthcare, right? Like, how do you access healthcare? What do we look like that's unique to us that may not be the same as another institution in our conference? And being able to do that self-study and continue to, flesh that out is super important. As you can imagine, you can get a lot of blind spots, but I think that sort of organizational approach, that compliance approach, that approach towards making certain that all of the resources are available is really important. And I think the biggest thing we've learned is it doesn't look the same for each institution, right? It looks very different in the collegiate level, the high school level, what's needed. The other thing is that, boy, there really are standards. There are best practices. There are things that should be in place to keep athletes safe. And it's really, in some ways, disappointing that, there isn't more programming that addresses that and does it. I mean, the stat that I throw out from last year in 2024 is that, by our count, there were well over 35 athletes that died during sport or training for sport in the high school or collegiate space. And it's just like, are we going to accept that? And they're all almost always things that could be preventable. So how are we looking at that? What are we doing? What are we doing around that space? And are we doing the right things to make certain athletes are safe?
Yeah, and is that mainly heat related, or what are a lot of those look like?
Yeah, certainly concussion, head injury is one. Exertional heat illness, as you know, in like the beginning of August for football is a huge issue. Mental health issues, mental health is a huge issue, and unfortunately, suicide, which is not 100% preventable, but certainly could we be doing a better job in that space? Yes, these are some of the catastrophic things, but there's so many other things, that are important when you think about it from an organizational standpoint to address health and safety.
Yeah, and is there obviously you're on the college and you've gone downstream a little bit. On the pro side, is there pretty good continuity between all of them now? Is that part of what you're building, is to build that continuity? Like what does it look like, I guess, then as you go from college, or you might have, let's just say you use USCAH in youth sports, and you go to college, let's just say you're in the Big Ten or in Ohio State, and then you're using you guys through the Big Ten, then you go to the NFL or the pros. Like, does it change throughout? Is it pretty standard, or is
Now,
that
that's
part
the
of the problem?
problem. There isn't a lot of consistency and standardization, which there needs to be, right? I mean, we know the power of like consistency, education, compliance. We also know, and not that it's not important in the pros, but by the time you reach that level, we know that you really should have already had all this, right? You should be really well educated, what we call athletic healthcare literacy. Like you should be able to know these things and be able to ask questions and advocate for yourself. And not that we don't want that sooner, but if we don't build that early on, if we don't build that into kind of the fabric of sport, it's missing. So, the pro sports, it's not that it's not important, but we need to make certain that parents, young people, high school athletes, college athletes, they're developing that athletic healthcare literacy.
Yeah, and as sports evolve, even right, as football, if you just look at helmets or just technology in general, what's the, I guess, procedure or the process when things start to change on the field or technology? How do you guys, like, what's the process look like to then also make sure you guys are staying up to date?
Yeah, I think that's where we're really valuable with our staff. I mean, we've got experts in the field that are consistently evaluating the evidence, consistently looking at those things and updating things in real time. So unlike something that might be 4 or 5 or 6 years old and might not be relevant, everything we have is, moving and living and updated. And so we're on the forefront of looking at all of those issues. You mentioned football, the use of, for example, a helmet add-on or a cap or something like that.
Yeah,
What is the evidence? What's the difference in the NFL versus high school youth football? How important is a good helmet versus just putting a cap on a bad helmet? All of these sorts of things that can get misconstrued if you're not really paying attention to it, and trying to answer those questions and help people ask the right questions so that they know that that athletes are being taken care of and are safe.
yeah. Now, from an evolution standpoint, let's just, I don't know, go back to when you started at Ohio State, Jim. Like, what really good, like, drastic changes where today in 2025 is so much better than, we'll just put a stamp on it, in 2000? Or, still a ton room way to go in 2050, call it? Or what's the evolution looked like across, or how fast has it caught up?
Yeah, unfortunately, not fast enough. I think, unfortunately, we're still seeing, issues that really probably we should not see in sport, right? I mean, one of my former teammates, Corey Stringer, passed away. He's the last NFL player to die of heat illness. And since his death, there hasn't been a death in the NFL, from exertional heat illness. But every year we have high school athletes that die from exertional heat illness. I mean, it's hard to imagine that we can't do a better job, or that we accept that, in my opinion, like that's accepted. So what should we do? I mean, there needs to be a standard way, we feel like, in a consistent way to deliver the appropriate training to individuals. Doesn't mean that they're always going to follow it, but we know, I'll give you a good example. The way concussion is dealt with today is so much different than it was in 2000. And that's because of education, state laws, the advocacy to do that. And so now our management of concussion, the way concussed athletes are evaluated, the way we pay attention to it, is so much different. And we should be doing that across sport for health and safety, because the bottom line with all of this is that athletes, when they're healthy and safe, mentally, physically, emotionally, they perform better, they perform longer, they're less likely to have issues like that don't allow them to perform, and they enjoy sport more. So if that's the case, why aren't we doing more around it? That's kind of our message. Like, let's do more around it. It's not a negative, it's actually a huge positive.
Yeah, it's interesting. And I don't know how in college you were from an injury standpoint, but I played basketball at Boston U, and I constantly, 5 years ago, NCAA tournament, it's crazy.
Yeah.
But I constantly dealt with injuries every year, but they were all so different. It was really wild to see the different ways I was handled. I had a concussion, I had a broken wrist, I got really sick and they couldn't figure it out. And then I got vertigo off the concussion, which was a whole nother thing. There was always something going on. And it was just interesting to see like how it wasn't always super cohesive between units and the team. And obviously BU is not Big Ten or,
Yeah.
higher up. So I'm sure we have less resources than those levels. But, how do you also then internally take, and this is probably more USC, but like, how are you then to go take it to a smaller school or a high school with less resources? How do you, manage the differences in maybe personnel or resources that are available?
Yeah, it's a great question. You've got to understand all of those environments, right? I mean, I think that's like it's what I tell people, like the difference between a big academic medical center and a small community hospital. Like both can provide great care in their spaces. We just got to understand them well and what they can do really well. And there should be a baseline that they should be able to provide, right? And so that's kind of the issue in sport. And so, we've got to look at like a high school that may not have an athletic trainer, which is terrible. But if they don't, how can we actually institute training, policies, procedures that keep athletes safe, as opposed to Boston U, which may have a great athletic training staff, but they still need some policies, education, consistency to do that. And so there's a lot around understanding those environments and how to interact with them that's really important. And I think, as you mentioned, it should be in some ways resource independent, right? Like health and
Mm.
safety of athletes shouldn't depend necessarily only on resources. We should be able to reach a baseline standard for those involved in athletics that promotes health and safety.
Yeah, we had an interesting one. Our team played in Cancun, and all like half our team got sick, and they didn't have like anyone to.
Yeah.
So that was interesting. And then the most interesting one I saw in the sort of like just brings back memories of what you guys are doing of where there could have been better standards. But I broke my nose in practice and at Loyola, and they took me like they didn't have like our guy couldn't do it, and they took me to like the hood of Baltimore at like and it was just like a whole new experience of like there's just a different side of healthcare. And so I'm always curious like how you balance it based on different personnel and resources. And I'm sure
Yeah.
that's one of the toughest things, especially probably as you go downstream into youth, where maybe it's just a parent that's sort of overseeing it or a super young, right out of college person that doesn't know as much.
Yeah,
It's
you got
interesting.
to train people, right? You got to train coaches, you got to train parents. It doesn't mean you turn into a medical professional, but like you've got to understand the basics of what protects a kid from getting exertional heat illness. You got to understand the basics of concussion. You got to understand the basics of an emergency action plan and why it's important. And I'll be honest with you, if you talk to a coach or a parent or anyone else who's ever been involved in that and saved a life,
Mhm.
they will tell you it's the most important thing you'll ever do. And on the flip side of that, if you've been had the misfortune of dealing with an athlete that's died during
Mhm.
athletics, they will tell you how what a critical miss it is to not have it in place.
Yeah, and it's interesting because it's like everyone thinks it won't happen to them or their team. Like it's super overlooked, and then if it happens, I'm sure like you really have two ends of the spectrum on. It's like oh whatever, but then it's like if it happens or you see it or it's a close call, you want to fully implement it. But I guess going forward, what are the trends or what are some things you're working on or
Yeah.
what's just going on in the macro that can get people up to speed of where else to pay attention or just to have a better understanding of the space for where it's going.
Well, I think the biggest thing is creating some consistency and alignment amongst how you train people and where that comes from. And we're one of the few countries that doesn't do that in an efficient, consistent manner. I mean, a lot of, we don't have a minister of sport like some countries, who sets that. And we're probably not going to. I mean, that's America, that's 50 states. But I think the real trend you're going to start to see from big organizations is thinking more about how to do that consistently. Like, what does it mean to provide good health care to your athletes if you're in a national governing body and part of the, under the umbrella of the USOPC? If you're a big youth sports organization, what does it mean to train a coach? What kind of training do they need to have? What does it mean to provide good resources to parents so that they can ask good questions and be part of, that journey around health and safety? And I think that's the evolution here. It's this idea that what we can't do is accept, like you mentioned, the things that we know are going to happen and have been happening that lead to bad outcomes. And then what allows, the secret to performance right now is making certain an athlete is healthy and well. That's, like I tell people all the time, the best recovery thing out there mentally, physically is sleep, yet we ignore it. Like there's no medicine or device or anything else that so there's things that we need to be educating on that people think about from a health standpoint, but it all crosses over to performance. And when you solve that secret sauce, now you've got an athlete that can really perform at their, at their peak. And that's really what we're driving at.
Yeah, and it feels like there is a lot of evolution. At least, again, I can just only speak from experience, but it was also who our trainer was. So
Yeah.
BU, for example, I don't know why, but like we pump out talent, but they always are like 1 year. So we had a different strength and conditioning coach every year, but they always left and went to go somewhere bigger. One was like University of Denver head, then Bowling Green head, then Iowa football. Like it was crazy, but everyone had a different implementation, but it literally got better every year. So it was almost like what they were learning in training. By the end of my last year, we had heart rate monitors. We were testing like all that stuff. We were monitoring sleep. We were doing questionnaires. And like a lot of times as players, we hated it. We're like, oh, we got to do this. But looking back, it was like we had way less injuries. We won our like everything actually improved. And so not directly correlated, but there's some correlation for sure,
Yeah, there's no doubt.
which is cool.
No doubt, the performance, the sports science crossing over to health, athletic training has advanced its field significantly. I mean, athletic trainers are amazing today. You mentioned strength and conditioning folks, physician, but that's a healthcare team, and that's team-based care. And that type of care is so important to the performance of athletes. And you experienced it as have less injuries, as you mentioned, as you have better recovery, all of those sorts of things. You played better, your team played better, you had better outcomes, and overall, a great experience.
Yeah, it's true. Super cool. This has been an awesome conversation, Jim. For people that want to learn more about what the Big Ten's doing and then also the USCAH, where can they go? What's website or best place to just gather more information?
Yeah, I think our website at www.uscah.com is a great place to go. It'll introduce you to everything that we're doing in sport and what we're about. And info at usca.com for any information that you want. I mean, we're always looking for those sorts of things. The Big Ten, obviously the Big Ten website is a great place to go to look at that. But I think, I did just encourage everybody to educate themselves on this, especially if you have a person you care about in sport, as a child in sport. If you're a coach in sport, there's nothing more important than the health and safety, well-being of athletes. It's how they perform their best.
Yeah, and what if there was like three things or just a couple things? What are the most
Yeah.
important to like get up to speed on, or at least have some basic knowledge of? I would guess. I'm just guessing. I'm curious to your answer, but I'd guess CPR, concussion, and then I don't know, like emergency response of something
Yeah,
bad.
from a healthcare standpoint, I would say it's emergency action planning, which covers some of the things you just talked about. So, how do you respond to an emergency, whether it's cardiac emergency, heat illness? You need to have that. I think the second thing I would say is, how does an athlete appropriately recover? Like, recovery is a really huge part of health and well-being for athletes. It's not about always the training, it's about how they recover. So, how does an athlete, we talked about appropriate sleep, nutrition, how do you think about peer interactions? What does that mean, mental health to an athlete and how they perform? And then the last thing I would say is how to be a positive influence on athletes, like caring for your athlete, like for parents, for youth athletes, high school, even college, like how do you be a positive influence on the athlete and help them in that journey? Three most important things I can think of here.
Amazing. Yeah, this has been awesome, and make sure to check out the website. We'll put the link and everything, but appreciate you coming on, and look forward to having you on in a few years and having all the hearing all the great progress we've made. And it's cool. It's a cool space. I appreciate you. Learned a lot. I always tell people I do these for myself more than all you. So
Great. No, it's great to be here. Anytime I can come on and, and chat, I'm always happy to do it. Doing great stuff and appreciate you having me.